Before we get started, I want to ask you a simple question. What if everything you've been told about neuropathy is wrong? What if the burning, the tingling, the numbness, the balance problems you're experiencing aren't simply something you have to live with? Because that's exactly what I was told. My name is Dr. Brady Wyrick. I'm a chiropractor, functional medicine practitioner, and a functional neurology expert. But before I was helping patients with neuropathy, I was a neuropathy patient myself. In 2009, I was diagnosed with testicular cancer. I went through chemotherapy, and if you've ever known someone who's gone through chemo, you've probably heard the horror stories, the fatigue, the nausea, the feeling that your body just isn't your own. And honestly, those stories are all true. A few months after finishing treatment, I took a backpacking trip through Yellowstone National Park. I spent 5 days hiking through the backcountry, and when I got home, my feet felt strange. It was like I was walking on wadded up socks. They burned, they tingled, and they just didn't feel like my feet anymore. And at first I blamed the hike. I figured I'd simply overdone it. But days turned into weeks, weeks turned into months, and the symptoms kept getting worse. So I went looking for answers. And what I was told changed my life. My oncologist looked me in the eye and said, well, it's hell to get old, isn't it? And I was 31 years old. And I remember thinking that cannot be the answer. And that moment sent me down a path that completely changed the direction of my career. I started studying nerves, circulation, neurology, metabolism, just doubling down on all these things and everything I could find why nerves stopped working in the first place. And what I discovered eventually became the foundation for the neuropathy program that we're using today. And since then, we've helped people across the United States and maintain a very high success rate. Not because we have a magic pill and not because we have some miracle treatment, but because we learn to focus on the things nerves actually need in order to recover. And if you understand what I'm about to show you over the next 8 or so minutes, it may completely change the way you think about neuropathy and what may be possible moving forward. So stay with me, because before you make another decision about your neuropathy, there are a few things you absolutely need to understand. So let me ask you another question. Are you actually happy with your health right now? Because if you're watching this, there's a good chance you've been dealing with burning in your feet, tingling or numbness, maybe even balance issues. And here's the truth. Those aren't random symptoms. Those are signals. They are your body's version of a check engine light. Now think about it this way. When your car's check engine light comes on, do you cover it up with a piece of tape? Of course not. You figure out what's wrong. But when it comes to your body, most people are told to do the exact opposite. Have you ever been told that your feeling is just part of getting older, or you're simply something you're going to have to live with? Because that's exactly what I was told after going through chemo, and I did not buy it. And what I discovered changed everything, because neuropathy wasn't behaving the way I had been told. The problem wasn't simply damaged nerves. The problem was that damaged nerves were being left in an environment where healing was impossible. And when I changed that environment, my body started changing. The numbness improved, the tingling improved, the strange sock feeling improved, and eventually it was all gone. And that experience changed the direction of my career forever. So over the last several years, I've refined that same approach, and I use it to help people from all over. But let me be very clear. There is no treatment that fixes neuropathy while you just sit on the couch and hope for the best. In fact, most, if not all, of our program is done at home. Why? Because healing doesn't happen in our office. Healing happens when you consistently give your body what it needs day after day. Our job is to show you what to do. Your job is to actually do it. The patients who get the best results are not the ones that are looking for a miracle. They are the ones that are willing to put in the work. And the good news is the work is simple. The challenge is being consistent, because your body wants to heal, but you have to give it the opportunity. But we have to focus on things nerves actually need to recover. Now, before I explain that, I need you to understand something very important. The nervous system has two parts: your brain and your spinal cord, and the nerves that travel through your arms, hands, legs, and feet. Neuropathy affects those peripheral nerves. And here's what most people don't know. Those nerves are wrapped in a protective coating called myelin. Think of it as like insulation through an electrical wire. For that system to work, it needs one thing: blood flow, and a lot of it. Tiny blood vessels surround those nerves, feeding them oxygen and nutrients. But when that blood flow decreases, those nerves don't just hurt, they start to starve. At first, you feel tingling, maybe numbness, zaps of pain. That's the nerve misfiring. But if the blood supply continues to drop, the nerves begin to die. And this is why neuropathy starts subtle, then spreads, then gets worse, until one day you realize it isn't affecting your balance, it's affecting your balance, your sleep, and even your independence. And here's the part that most people miss. Neuropathy does not stay the same. It either gets better or it gets worse. Neuropathy is not a medication deficiency, and neuropathy is not simply a pain problem. Neuropathy is a circulation problem, a fuel problem, and an activation problem. Think about it. Every nerve in your body requires oxygen, nutrients, blood flow, and stimulation. When those things decrease, nerves begin to malfunction. First comes the tingling, then the numbness, then the burning, then the balance problems. And if nothing changes, the condition continues to progress. And that's why simply covering the symptoms with medication isn't enough. Over 24 million Americans are dealing with this. Many live with symptoms for 4 to 5 years before diagnosis, and at that point, the damage is often advanced. People start falling, getting injured, losing sensation completely, and this is not just about discomfort, this is about quality of life. Now, let's talk about that system that's supposed to help you, because this is where most people get stuck. The medical system is excellent at emergencies and broken bones, but neuropathy, that's a chronic condition. And chronic conditions don't get solved with quick fixes. So what happens? You get medication. The doses go up. Maybe you get referred out, but nothing is actually stopping the nerve damage. This is why we see more medications, more progression, and in severe cases, amputations. There's over 80,000 amputations per year in the United States linked to neuropathy complications. Not because people don't care, but because they were never given the right approach. So what was it that I discovered? The same 3 things we built our entire program around. First, restore blood flow. Starving nerves don't heal. We use low-level light therapy to stimulate angiogenesis, which is your body's ability to create new blood flow. More blood flow equals more oxygen and nutrients and better conditions for repair. Second, reactivate the nerves. Damaged nerves either misfire or they don't fire at all. We use advanced stimulation to retrain those nerves so they can function properly again. Third, fuel the system, because healing requires raw materials. We support the body with anti-inflammatory nutrition, nitric oxide support, and key nutrients for nerve repair. Because without fuel, healing doesn't happen. Think of it like this. If you break your arm, your cast doesn't heal the arm, your body does. The cast just puts it in the right position to heal, and that's exactly what we're doing here. When those 3 things come together, amazing things can happen, not because we're treating neuropathy, but because we're creating an environment where the body can do what it was designed to do, heal. Now here's the question. What if you've been told the wrong story? What if neuropathy isn't simply something you have to live with? What if these are the things happening beneath the surface that the body hasn't evaluated? Nobody's evaluated that yet. That's exactly why we offer a comprehensive neuropathy evaluation. If you're here in the Idaho Falls area, click the link below and get that scheduled. We'll determine what's causing your symptoms, how severe the nerve damage may be, and whether you're a candidate for our program. If you're outside of our area, schedule a discovery call. We'll talk about your questions, and we'll talk about your situation, answer your questions, and help you determine whether our approach might be a fit for you. The $249 fee for this evaluation will be waived in both quick cases, but you have to book now with the link below. You don't have to spend the next 5 years wondering if this is just how life is going to be, while your nerves get closer and closer to that point of no return. So take the next step and let's see what's really going on.